your faces. But if you have questions, or you have comments, you can interrupt me anytime. Just put up the raise hand emoji. And I think I need the help of the other faculty or Simon, okay, para to inform me. Okay, so let's start with the learning outcome. Okay, for first year, this is the learning outcome that is expected of you. Okay, given a female on her menarche, the student should be able to explain developmental and cyclical histologic changes in the female reproductive tract, including the mammary gland. So I have already the recorded lecture in Canvas, and hopefully most of you have already at least scanned through the recorded lecture. We have two general divisions of the reproductive system of the female. Okay, those found internally, the ovaries, the tubes, uterus, vagina, and a temporary female organ, the placenta, during pregnancy. For the external, we have the vulva, composed of the labia majora, minora, vestibule, clitoris, the two glands, and the mons pubis. Okay, plus the breast or the mammary gland, because the mammary gland is a modified sweat gland found in female that also undergoes cyclical histologic changes. Okay, now grossly, this is the diagram. Okay, you have the uterus composed of the fundus, the body, the isthmus, the cervical, uterine cervix, the vagina, this is the vaginal canal, the fallopian tube, and the ovary. All right, and supporting those structures are the ligaments, okay, which you have already discussed in the gross lecture. Okay, so first we will look at the ovary. Okay, this is the ovary. I will not be very detailed since all of the details are in the recorded lecture. So I will just point out important histologic features of each organ. Okay, this is the ovary. So all of us know that this has a reproductive function because it produces oocyte. May question? Okay, so this is the ovary, the diagram of the ovary, and here is the histologic section with ordinary age and easting. Okay, you have two layers, the cortex and the medulla. The outermost layer is covered by, which is called the surface epithelium or the germinal epithelium, composed of simple cuboidal epithelium to. Okay? So, in the ovary, ang tawag sa kanya surface epithelium or germinal epithelium. Okay? In some organs, it is synonymous to the serosa. Okay? Or the visceral peritoneum. Now, in the medulla, what will you see there are the blood vessels, veins, arteries, lymphatics, and nerves, okay, nerve bundles. And sa cortex, you will find the follicles, the developing follicles. Okay, so we will review the different stages of ovarian follicular development. So all of those changes happening in the female reproductive tract is influenced by hormones. Okay, and you already had your lecture in endocrine organs, and you also have, I think you also have already your lecture in physiology, right? For endocrine. So more or less you have an idea on the endocrine regulation of the different organs of the body, most especially the reproductive organs of the female. Now the youngest is called a primordial follicle. Then the primordial will differentiate into a primary. Now the primary have two substages, the unilaminar and the multilaminar. The third stage is called the antral or vesicular or secondary ovarian follicle. And the last stage is your mature or Graafian or pre-ovulatory ovarian follicle. Okay, and in a diagram, this is to show you how they will appear. Okay, in the real histologic section, so ito sila, okay, found in the cortex. Okay, they are in the cortex of the ovary. Right. Now, after the oocyte have been extruded, so this mature follicle will rupture, then will release the oocyte. After the release, what will be left is the corpus luteum. Okay? Corpus luteum na yung tawag, what it will be called. Okay, that's luteum refers to the to yellow, means yellow, and corpus is uh, body. So you have a yellow body on gross specimen ovary. Okay, so these are the stages. Okay, and let us look at each in diagram and in histologic section. Okay, primordial follicle is the youngest. You have what it is, what is a primordial follicle? So it is composed of the oocyte, okay, oocyte in the center, surrounded by a single layer of follicle cells. Okay, so isang layer lang yan. And it is squamous in classification or in appearance. Okay, so flat pa lang. Still flat. Okay. So in the actual specimen, so this is how it will look like. You have the oocyte here, and you have the follicle cells surrounding it. And you have several primordial follicles here. In between the follicles is the intervening stromal cells. Ito yon in the diagram. All right. Now, the primordial will differentiate or develop into a primary follicle. And the primary follicle will still have a single layer of follicle cells, but this time it will be cuboidal in shape, surrounding the oocyte still. Okay, so that's the only difference from primordial to a primary unilaminar ovarian follicle. Okay, cuboidal na. Right, and you have now the formation of the zona pellucida. Okay, this is the zona pellucida. What is the function or what cell secretes the zona pellucida? Anyone? Which cell secretes the zona pellucida?
Oocyte.
Okay, the oocyte. Correct. Okay, the oocyte secretes the zona pellucida. And the zona pellucida is made up of sulfated acidic glycoproteins. You have three components of that glycoproteins here called your ZP1, ZP2, and ZP3. Okay, the ZP2 is important in fertilization, ZP2 and ZP3, because the ZP2 is the secondary spermatozoa binding protein and the ZP3 is the spermatozoa binding receptor found yan in the zona pellucida. So zona pellucida is an important structure in fertilization. Now still a primary follicle, but now the follicle cells are multilaminar already. So in several layers. Yung follicle cells kanina, that is single layer of cuboidal cells, will now proliferate and become stratified. Okay, stratified cuboidal na siya. Okay, and this layer is now called the stratum granulosum. And the follicle cells are now called your granulosa cell. Okay, so from follicle cells, it becomes granulosa cells when it is already in several layers. Okay, now in this enlarged diagram, you will see here that the oocyte have microvilli. Okay, so these are the microvilli, and the granulosa cell have slender cell processes that interdigitates with the microvilli of your oocyte. Okay, so for communication or for nourishment also of your oocyte. Okay, so aside from that, it is now stratified cuboidal, the surrounding stroma here, yan, yung surrounding stroma will differentiate into your theca folliculi. Okay, so it is now called your theca folliculi, the stroma that surrounds the stratum granulosum. Okay. Okay, so for the growth of your ovarian follicle, you need your follicle stimulating hormone, growth factor, and calcium. Okay, and it will continue to differentiate now into your secondary follicle. Okay, so what do you see now in the secondary follicle? Or vesicular follicle or antral follicle. Yung A here stands for the antrum. Okay, antrum is a space. Okay, this one is a space because your granulosa cells will now produce a fluid called your liquor folliculi or follicular fluid. It is a fluid that is rich in hyaluronan. Okay. Now, granulosa cell will also secrete substance called your oocyte maturation inhibitor. Okay, this substance inhibits the growth of the oocyte. So, baka naman sumobrang laki ni oocyte. So, there's also a product secreted by the granulosa cells that will inhibit the growth of the oocyte. Okay. Now, aside from that liquor folliculi, you will also observe the antrum. You will also observe this Call Exner bodies that is situated randomly between the granulosa cells. So this also contains secretions or the liquor follicle. Okay, but it is surrounded by granulosa. All right. Now, from secondary, now you have, it will differentiate into a mature ovarian follicle or the Graafian follicle. Now, what happens here is that you have the several antral spaces will coalesce into a single large antral space, and the stratum granulosum will become thinner along the sides, but will produce a mound here that will connect with the granulosa cells that surrounds the oocyte, and you call this area the cumulus ooporus. Okay, this remains as the connection of the granulosa cells that surrounds the oocyte with the stratum granulosum. I think I forgot to mention here that in this also secondary phase, the theca folliculi will now differentiate into two layers, the theca interna and theca externa. Okay, the theca interna are cuboidal cells, okay, plump cuboidal cells, and the theca externa is composed of your smooth muscle and collagen fibers. Okay, so in histologic, in the real specimen, this is how it will look like. So you have your stratum granulosum here, the cumulus ooporus, the oocyte, the single large antrum here, the theca interna, surrounded by the theca externa. The theca externa is already the ovarian stroma, so it will be similar, okay, in appearance with the rest of the ovarian stroma. Okay, so when the ovarian follicle is already mature, approximately on day 14 of the menstrual cycle, you have it will, because of the accumulation of the fluid, it will compress one area of the ovary, and on gross, we will see this as a whitish area here called the follicular stigma. Okay, so this is a bulging area. You will see it on the outer surface of the ovary, and this area of the germinal epithelium overlying the bulging follicle will rupture due to ischemia, or uh, decrease, or you have a cut off of the blood supply of this area, so it will rupture. And these are the factors responsible for the release of the oocyte. So as mentioned, you have increase in the volume and pressure of the liquor folliculi. You have enzymatic proteolysis of the follicular wall. You have also hormonal directed deposition of glycosaminoglycans and contraction of the smooth muscle cell fibers in the theca externa layer. Alright, so after the rupture, so the oocyte has been released, what will remain now of the follicle is the corpus luteum. So it will differentiate into a corpus luteum. And your corpus luteum, as discussed, this has been mentioned in the endocrine lecture, it has two layers. Okay, the inner is composed of granulosa lutein cells, and the outer is composed of the theca lutein cells. Okay, kaya may iba na yung name, it has been luteinized. Okay, the cells have been luteinized because of the increase in the level of luteinizing hormone. Okay, so your granulosa cells are polygonal cells larger than your theca lutein cells here. And your theca lutein cells are seen between the folds of the corpus luteum wall. Okay, nandito siya sa gilid-gilid, sa singit-singit niyan of the folds. Okay, the theca cells are smaller than your theca lutein cells are smaller than the granulosa lutein cells, and they are more or less cuboidal with uh, paler cytoplasm. Okay, so the corpus luteum will not stay forever in the ovary. It will regress into and involutes into a corpus albicans. Okay, so you have here penetration of the collagen fibers penetrating the corpus luteum, okay, and replacing it with stromal cells and collagen fibers. Yes, may question? May tanong? Comments? Okay, so corpus albicans means white. So it is a whitish body that will be seen on the fresh specimen when you cut the ovary. Yeah, corpus albicans. So less cellular, more of fibers in this area of your corpus albicans. Okay, so only one, okay, pag maturation of the ovarian follicle, only one will proceed into full maturation. Okay, so what will happen to the rest of the developing ovarian follicles? Okay, it will undergo atresia. Okay, atresia. So this will now be called an atretic follicle. Okay, so what is an atretic follicle? The follicle undergoes apoptosis, and you have detachment of granulosa cells, okay, from the wall. You have autolysis of the oocyte. So like here, wala na yung nucleus niya. Okay. And you have collapse of the zona pellucida. Okay. Then macrophages will invade the degenerating follicle and will phagocytose the debris. Then fibroblasts will penetrate the area, okay, leaving it as stromal tissue na lang. Okay. So normally, yes, isa lang dapat yung only one ovarian follicle will undergo full maturation. But in some cases, minsan dalawa. Okay. All right. Now, how about the ovary? The oocyte. Okay, the oocyte also undergoes maturation or development. Okay, and you call that maturation of the oocyte, oogenesis. Okay, oogenesis begins in the female fetus with primary oocyte arresting at prophase 1 in primordial follicles. Okay, this will remain inactive during childhood. Then at puberty, a certain population of the primordial follicles begin to develop each month. So by batch will develop each month. Okay, and it will continue the process of cell division until it reach yung meiosis 2. Okay? Now, the follicle will remain in meiosis 2 until and will never continue until it is or if it is fertilized by a sperm. Okay. So, andyan lang siya. But if it is fertilized by a sperm, it will continue its cell division in meiosis 2. Okay, so imagine that okay, in yung your oocyte, you have oogonia, yung youngest form of your oocyte. Okay, you have 600,000 in the fetus at 2 months of gestation. Okay, then at 3 months of gestation, 5 months of gestation, 7 million na. You have 7 million of the oogonia. The oogonia will develop into a primary oocyte. So you have 7 million of those. But each month, a certain batch of your primary oocyte undergoes apoptosis. Okay, so during birth or just after birth, you will only have 300,000 primary oocyte. And each month then, by batch, a certain number will undergo again apoptosis during the menstrual cycle. Okay, so what is the difference of the primary and secondary oocyte? Okay, the secondary oocyte is found in the mature Graafian follicle. Okay, and it has only half of the chromosome number, which is 23. Okay, yung primary oocyte, you have 46. Okay? All right, now let's go to the tubes. Okay, this is the uterine tube or the fallopian tube. Okay, and these are the parts grossly. You have the intramural, isthmus, ampulla, and infundibulum. Okay, and this is how it looks like on cut section histologically. Okay, so the mucosa forms intraluminal folds lined by two types of cells, your ciliated columnar and the non-ciliated columnar called your secretory peg cells. Okay. Now the pointer here, the black arrow points to a secretory peg cells. Now, how will you know na secretory peg cells? It is not ciliated or non-ciliated. Okay, the rest, the majority are ciliated columnar. Okay. So here, so like the ovary, the fallopian tube also undergoes changes during the menstrual cycle. Now, at the peak of its change, you have here the secretory peg cells showing hobnail appearance. So these are the secretions, okay, about to be excreted by your secretory peg cells. So this happens, the peak of its development happens after ovulation in preparation for the to receive the oocyte, okay, that has been released. Right, so it does not only provide nourishment for the oocyte, and if it happens that there will be sperm cells to fertilize the oocyte, Okay, the secretory cells also provide nourishment for those sperm cells. Okay, let's go to the uterine wall layer. Okay, this is the body of the uterus. You have three layers: endometrium, myometrium, and perimetrium. The endometrium represents the mucosa, the myometrium muscular layer, and the perimetrium the serosa or the visceral peritoneum. Okay, let's now first see the endometrium. Okay, the endometrium I think has the most dramatic changes during the menstrual cycle because of the influence of the ovarian hormones on the endometrium. Okay, so first of all, your endometrium has two layers. Okay, the uh, the functional layer and the basal layer. Okay, the stratum functionale and the stratum basale. Okay, the one that undergoes changes is the three phases of changes. Okay, we have the first one is the menstrual phase, second is the proliferative, and third is the secretory. Okay, so this is the proliferative, secretory, and menstrual. Okay. So as yung those females, okay, so the females that undergoes uh, yung normal ovarian cycle will usually have, so correct me if I'm wrong, yung mga OB dito, okay, 20, ilang days of cycle, yung mean is 28, okay, but it can vary from 25 to 35 days. Correct ba? Okay, so 25 to 35 days. It can vary.
Ma'am, sorry po. Ma'am Mel,
Yes.
this is Carme. Ma'am, ano po, interval po is between 20, accepted po na interval is 21 to 35 days.
Okay, so 21. Okay, so accepted. Thank you, Dr. Carmi. Okay, that's the accepted. So in a normal cycle, okay, 21 to 35 days. Okay, but the ovulation is usually falls on day 14. Okay, what is day 1? Day 1 is the first day of menstruation. That's day 1. Yun ang laging day 1, first day of menstruation. So as you will see here in the image, pag menstrual phase, you have fragmented endometrium, okay, with intervening blood, okay, and you have infiltration of inflammatory cells like your neutrophils and lymphocytes. Okay. Ayan. There's sloughing of, nagsished na. Okay, you have shedding of the mucosa, or at least the functional layer of the mucosa or of the endometrium. Okay. Now, after which, syempre, they have to proliferate to prepare again for another cycle. You have next phase is the proliferative phase. Okay, so in the proliferative phase, this is how it looks like. You have tubular glands. Okay, small tubular glands, empty. The lumen is empty. And you have a compactly arranged stroma. Then after ovulation, after ovulation is the secretory phase. Okay. Your glands are corkscrew in shape. Okay, corkscrew or coiled in shape. And the lining cuboidal cells have supra and infra nuclear vacuolizations, and the lumen contains secretions. Okay, the stroma, siguro hindi masyadong kita dito, but in the lab guide, you will see more of this. The stroma is edematous because you have fluid, accumulation of fluid in the stroma, and you have changes in the stromal cells. Hindi na siya, it's not anymore spindle shape, it's more plump, okay, almost polygonal in shape. And you call that decidualization because of the effect of the hormones, decidualization of the stromal cells. Okay, in preparation for, if ever, pregnancy will happen. Okay, mga nourishment yan, secretions na yan. Okay, so in a table, this is just what I have said, okay, the description of the menstrual cycle, proliferative, secretory, or luteal, and menstrual. Menstrual is just shedding of the functional layer of the endometrium. Okay, so what makes it happen? Why is it only the functional layer that is being shed during menstrual period? It's because it has something to do with the blood supply. So the main blood supply of the uterus is the uterine artery, and it will give off branches into the myometrium. You call that your arcuate artery. The arcuate artery will again give off radial branches. Okay, this is the radial branch, and the radial branch will divide into a straight artery supplying the endometrium, the basal layer of the endometrium, and spiral artery supplying the functional layer of the endometrium. Okay, so there is a difference between the straight and spiral artery. Okay, the spiral, okay, the spiral arteries are sensitive to progesterone, okay, growing rapidly in spiral function as the functional layer thickens under the influence of the luteal steroid. So this one, okay, the spiral artery have receptors for hormone. Okay, may receptor siya for hormone, so it is affected by hormonal levels. Okay, while the straight arteries, they have no receptors, wala. So that kaya the basal layer is not affected by the cycle. Okay, wala siyang receptor for hormones. Okay, so why is it so that pareho namang mucosa, bakit? Why is it kailangan pa different blood supply? Okay, and different characteristic of the blood supply. Okay, so imagine if in the entire mucosa or the entire layer of the endometrium will be removed or shed during menstruation. So wala nang, what will be left? There's no more glands left for regeneration. Okay, kailangan mag-regenerate eh. So if the basal layer is not affected, you still have endometrial glands here that can be they will serve as the scaffolding for regeneration of new glands, okay, in the proliferative phase. Okay. Now those are phases dependent on hormonal change. What if there are no hormones anymore? Wala nang source of hormones. Okay, and in female, you call that status as the menopause stage. Okay, menopause. Okay, average age is of menopause, start of menopause is 45 to 50. Average yun, it pwedeng younger, pwedeng older than 50. Okay? So you have now cessation of hormones, estrogen and progesterone production. Okay, saan ba pinoproduce yung estrogen? Mostly, saan yung source ng estrogen and progesterone? Mainly. Sinong gustong sumagot? Saan galing yung estrogen and progesterone?
Sa ovaries po.
Sa ovaries. Okay, sa ovaries. So yung ovaries, if they stop producing estrogen and progesterone, so wala na rin, there's no hormones that will influence change the cycle in the endometrium. So if wala ng hormones, the glands will become atrophic. Okay, this is how atrophic glands look like. They will be very small, either very small with inactive cells lining it, or they will become cystic or dilated, lined by attenuated or flattened epithelial cells. Flat na. And the stroma will become thinner. Okay, manipis lang yung stroma niya. Okay, so this is an atrophic endometrium. Okay, that happens after menopause. Okay. Now, in the myometrium, it is just composed of bundles of smooth muscle cells in different planes of orientation. Okay. So you have longitudinal, oblique, and transverse orientations, okay, of your smooth muscle. That's the myometrium. So that's the thickest layer of the uterine wall, the myometrium. Ito, I think this has been shown by Dr. Bunying also. And the most common benign tumor arising from the myometrium is a leiomyoma. So similar to the appearance of your benign of your normal smooth muscle cell, except that it is faster in proliferation and forms a mass like this one. Okay. Yung endometrium, there are so many pathologies of the endometrium. Maraming disorders that can arise from the endometrium. So we will not have. Tsaka nyo na malalaman. Sa pathology na lang next year. All right. Now, all of these changes happening in the internal female reproductive organs are influenced by hormones. Okay, hormones. All right. So on the bottommost area of this illustration is the endometrium. Okay, followed by the hormones secreted by the ovary here. Okay, and the ovary undergoes also cycle. You call it the ovarian cycle. Pero dalawa lang. We have the follicular phase and luteal phase. Okay. And this is influenced by hormones secreted by the pituitary gland. Diba? Do you remember your endocrine lecture? Okay. The pituitary gland, we will not, since reproductive to, we will just concentrate on the luteinizing hormone and follicle stimulating hormone. Okay, so the follicle stimulating, as the name implies, influence the development of the ovarian follicle until it matures into a Graafian follicle, approximately until day 14 of the menstrual cycle. On day 14, there will be a surge of the luteinizing hormone. So magpipik yan, biglang taas, okay, on day 14, and after that, and that will trigger the release of the oocyte. Okay, so after the release of oocyte, the ovary will now be in the luteal phase. So after day 14, or depende, meron kasing hanggang, basta after ovulation, luteal phase na yon. Luteal because you have now the development of the corpus luteum. Okay, corpus luteum na yung magde-develop. Okay, that's why it's called the luteal phase of the ovarian cycle, influenced by the luteinizing hormone. That's why also the two layers of the corpus luteum are called granulosa lutein cells and theca lutein cells. Okay, Now, the ovarian cycle, the ovary produce hormones also depending on the ovarian cycle. Okay, sa follicular phase, there will be an increase in estrogen production. Okay, and estrogen influence the proliferative phase of the endometrium. So you will have a proliferation of the endometrial glands and stroma. Okay, then after ovulation, you will now have an increase in progesterone secretion of the ovary. Bakit? Because of the corpus luteum. Remember, yung granulosa cells mo are the ones mainly producing the progesterone. So there will be an increase in progesterone. And what is the effect of progesterone sa endometrium? The endometrium will now be in your secretory phase, so in preparation for a possible pregnancy. Kaya kumakapal yan, the endometrium will be thickened, will have fluid, will have secretions in the glands, okay, in preparation for implantation, if there will be fertilization. Okay. All right. Now let's see now the cervix. Okay, the uterine cervix. The cervix is part of the uterus. You call it cervix kasi synonym, parang ano na siya understood when you say cervix. It's the uterine cervix. Okay, you may also write the complete name na uterine cervix. Okay, so this is the uterine cervix and it has histologically, you have two parts. Okay, the endocervix and the ectocervix. Okay, so the endocervix is lined by mucin-secreting columnar cells, and the ectocervix is lined by non-keratinized stratified squamous epithelium. Okay, meron na naman ulit tayo dito, junction, squamocolumnar junction, which is called your transformation zone. Okay, this is the transformation zone, exactly there. Is the transformation zone. And it is important in the female reproductive system. Okay, why is this important? What happens in the transformation zone? What is the clinical significance of this transformation zone? Anyone?
Development po ng cervical cancer po to.
Okay, so this is the most common area where cells transform into a malignancy or cancerous form. Okay, so why? Bakit? Because this area, since this is a transformation zone, so this area can, like this one, can undergo metaplasia. Metaplasia is a benign change, but if there is, let's say, irritation of the cervix, so kasi, di ba, what have we studied about squamous epithelium? It is a thick epithelium, it protects, so it can extend, or yung columnar cells mo may undergo metaplastic changes and become squamous in appear, or become squamous, okay? And you call that metaplastic. Squamous metaplasia, okay? Para to protect that area. Okay, but sometimes if the irritation is continuously there, okay, hindi nawala. Okay, like example, HPV, human papilloma virus, okay, it can transform your cell into malignancy. Okay, magiging malignant siya. Right? Ito, metaplasia lang to. Ito, metaplasia, benign change lang siya. Okay, but if the injury, or if it's not cured, or if the irritating, either it's a virus or a bacteria or a chemical, anything, okay, can trigger this area to transform into malignancy. Okay? Kasi hindi stable yung DNA dito. Okay? Hindi stable. It can transform, kaya transformation soon. It can easily be adapted. It can easily adapt to its to whatever the environment is. Okay? Pwede silang magbago lagi. Alright, and the most common and efficient and effective tool or procedure to screen for cervical malignancy is the cervical swab. Okay, so cervical swab, you take a sample of the not only the cervix but also the vaginal wall. Then you put it on a slide, make a smear, and stain it with Papa Nicolau stain. Kaya pap smear yung tawag din because the stain used is Papa Nicolau. Okay, this is a normal smear on the left. This is an abnormal smear on the right. Okay, so this is already a malignant transformation of the lining epithelium of the cervix. Okay, malignant squamous na to. Right. So it is advisable na if you're already in the reproductive age to have screening, right? And also important that meron na ngayong vaccine for HPV. So recommended also to have to be vaccinated. Okay. Now this is a transformation, cytopathic viral change. Okay. So it's not malignant, pero there's a change caused by, not yet malignant, caused by your HPV type 6 and 11. So, ayan, you have a very dark, pycnotic, condensed nucleus and a clear surrounding cytoplasm. Viral change, though, cytopathic viral change. Those are just examples. Okay. So for after cervix, we'll now go to the vagina. Okay, the vagina, the vaginal wall is lined by non-keratinized stratified squamous epithelium. Okay, you have the lamina propria here, and you have the muscular layer, and not seen is the adventitia. Okay, now the muscular layer is you have smooth muscle, of course, and it is very rich in elastic fibers. Okay, very, very rich in elastic fibers. And also, this is vascular, okay, richly vascularized also. All right, so it needs that elastic characteristic because in normal delivery, in normal spontaneous delivery, vaginal delivery, so imagine the head of a baby passing through the vaginal canal. Ganong kalaki yung head? Average of mga 10 centimeters. Diba? So after birth, kailangan bumalik sa dati yan. If not to the original, at least near to the original diameter of the vaginal canal. So you need those elastic fibers for recoil. Kaya very rich in elastic fibers yung vaginal. Okay, so aside from that, in the epithelium, okay, so what do you notice here in the epithelium? The cytoplasm are pale or clear because it is rich in what substance?
Glycogen po, Doc.
Okay, glycogen. Okay, it is rich in glycogen. All right. Now, so it is rich in glycogen, and when this cells shed off, okay, or when they go apoptosis, okay, glycogen will be released. Okay, and the normal flora of the vaginal canal are lactobacilli. Okay, so those lactobacilli will ferment or digest yung glycogen, and what will be the product of that?
Lactic acid.
Okay, lactic acid. So it will serve as a natural bactericidal and bacteriostatic effect protection for the vaginal canal or vaginal wall, yung lactic acid. Kaya nga may lactacid, di ba? That's the principle behind mga feminine wash. Okay. Now let's go back to the corpus luteum. Okay. But this time, it's not just the usual luteal phase corpus luteum. This is the corpus luteum of pregnancy. Okay, so this is the ovary, and if you will notice, the corpus luteum of pregnancy occupies almost the entire of ovary. Okay, now what is the corpus luteum of pregnancy? So this happens, ayan, if there's implantation. Okay, if pregnancy happens, so there's implantation. Okay, so why do we have the corpus luteum of pregnancy? It will remain for at the most first trimester of pregnancy. You have the corpus luteum of pregnancy. Okay. So this one maintains or provides the nutrition or the hormones needed by the female during the early trimester or the early weeks of pregnancy. Okay? Kasi yung placenta mo, hindi pa naman siya, it's not yet well developed to provide all the needed hormones to maintain the pregnancy. So you need the corpus luteum to provide those hormones first. Okay? And what will trigger the corpus luteum to become the corpus luteum of pregnancy? So if you have implantation, you already have, meron ka ng syncytial trophoblast dun sa implanting developing placenta pala, interdeveloping placenta. So the syncytial trophoblast secretes the human gonadotropic hormone or HCG that will maintain the corpus luteum of pregnancy. Okay, so in return, the corpus luteum of pregnancy will produce those hormones, estrogen, progesterone, that you need to maintain pregnancy. Now, pag kaya na ng placenta, kaya na niyang i-provide all the hormones, this will disappear already. Parang mawawala na siya after the first trimester. And the placenta will take over to maintain pregnancy and provide nutrition for the developing fetus. Okay, now let's go to the placenta. Okay, so this is implantation review. Just review yung fertilization and implantation that was in the first trimester, first long exam, I think, or second long exam. Yun, diba? That's the lecture of Dr. Esguerra. Okay, so I will not discuss it again, but we will focus on the development of the placenta. Okay, the placenta is composed of chorionic villi. Okay, we will focus on the development of the chorionic villi. Okay. Before that, I just show first how the placenta looks like on histologic section. Okay, this is the placenta. This is an early or preterm placenta. Okay, and you have irregularly shaped, round to irregularly shaped chorionic villi. Okay, that's how it looks like. Okay, let's go back to the diagram. This is the development of the chorionic villus. Okay, and it is divided into a primary, secondary, and tertiary chorionic villi. Okay, now just focus on the components because it depends. That's how it is. The development depends on the components present. Okay, in the primary chorionic villus, you only have the trophoblast cells. Okay, those are the syncytial trophoblast, the outer lining, and the inner mass of cytotrophoblast. Okay. pag primary chorionic villi. Then it will differentiate into a secondary chorionic villi wherein you have now penetration of mesenchymal connective tissue in the center. Okay, so the mesenchymal connective tissue is surrounded by an inner layer of cytotrophoblast and outer layer of syncytiotropoblast. All right. Now, in the tertiary villi, tertiary villi, aside from the mesenchymal connective tissue and the trophoblast cells, there is now again penetrating structure, the fetal blood vessels. Okay, you have now your fetal blood vessels here. Okay, and in the late pregnancy, okay, yan, vascularized. Vascularized means the blood vessels contain blood contain blood. Okay, and in the late pregnancy, your cytotrophoblast still present, but it will be fewer, hindi na siya entirely lining the chorionic villus. Parang randomly distributed. Okay, but you still have the syncytiotropoblast lining the outermost layer. Okay. Now, for the placenta to be classified as an early or preterm placenta or a mature or term placenta depends on the appearance of the chorionic villus on histologic section. Okay, like this one, in the preterm or early placenta, you have larger chorionic villi, okay, mas malalaki. Then the chorionic villi have a core of mesenchymal connective tissue, but we don't see any blood vessels yet. Wala pang blood vessels. Okay. And the lining trophoblast, you have two layers, the inner cytotrophoblast and outer syncytiotropoblast. Okay. But in the mature or term placenta, the villi, chorionic villi, are smaller. Okay. You have the mesenchymal connective tissue already penetrated by fetal blood vessels. And the lining trophoblast, you only appreciate syncytiotropoblast na lang. Okay? There are still cytotrophoblasts, but they are indistinct or inconspicuous. Meron pa rin, but yun, cannot really, they are dispersed already. Okay. All right. Now, this is the mature placenta. You have the fetal blood in the fetal vessels inside the chorionic villus. Okay, and the content of the intervillus spaces, okay, yan, yung mga space dyan, contains the maternal blood. Okay. All right. Now, kung merong blood-air barrier, we also have the placental barrier, which consists of 1, 2, 3, 4, 5, 6 layers. Okay, the outermost. Okay, in the perspective of the chorionic villus, the outermost is the syncytiotropoblast. Okay, followed by the inner cytotrophoblast, then the basal lamina of the trophoblast, the mesenchymal connective tissue, the basal lamina of the endothelium, and the endothelium of the fetal blood vessel. Okay, so kung dito yon, so you have, yan, yung outer is the syncytiotropoblast, followed by the, kung makikita tayo, cytotrophoblast, the mesenchymal connective tissue, then the basement membrane of the, basement membrane of the, trophoblast, then the mesenchymal connective tissue, then the basement membrane of the fetal blood vessel, then the endothelium of the fetal blood vessel. Okay, now let's go now to the decidua. Okay, the placenta is from the baby. Okay, the decidua is from the mother because the decidua is a modified endometrium. Okay, modified endometrium during pregnancy. Okay, so okay, depending on the location, you have types of decidua. The decidua capsularis, the one that covers the chorionic, the one that covers the membranes, okay, chorionic membranes. Okay, the decidua, okay, the decidua basalis, okay, the interface between the uterus and the placenta. Okay, uterus and placenta, that's the decidua basalis. And the decidua parietalis, the endometrium that covers the uterus that is not involved or hindi siya connected with the developing fetus dito. Okay. Ayan. So what is, why is it you have the decidua? Okay. Now you have here, this is the decidua, the stromal cells that becomes more polygonal in shape, larger, and secrete also hormones. Okay, and you have here the endometrial glands that becomes hypersecretory. Okay, naging hypersecretory na siya. Okay, because this provides nourishment, diba, for the developing fetus and for the placenta also. Okay, so that's why you have the decidua, okay, and gestational endometrium. Ito yung gestational endometrium also. Decidua refers to the endometrial stroma, and gestational endometrium refers to the endometrial gland. Okay, so it also serves as a protection, kaya siya may interface between the, may decidua basalis, so interface between the maternal and the fetal. Okay, so that the maternal immune system will not attack the developing fetus and placenta. Yun yung isa pa niyang function. Okay? And it provides a controlled penetration of the placenta. So during implantation, controlled implantation or penetration of the chorionic villi into the endometrium. Okay? So if you don't have decidua basalis, okay, kung walang decidua, you have a direct contact between the chorionic villus of the placenta and the uterine wall. Okay, so dikit na dikit dyan. Dikit na dikit. So during birth, okay, the placenta will not separate from the uterine wall. Okay, or worse, if the placenta have penetrated all the way to the entire thickness of the uterine wall, it can cause bleeding and rupture of the uterine wall. Okay, so another part during pregnancy, another structure is the fetal membranes. Okay, you have two layers of the fetal membranes: the chorion, the thicker one, and the amnion, the thinner one. Okay, the amnion, you have here is the mesenchymal layer. You have the basement membrane and a single layer of epithelial cells derived from the extraembryonic ectoderm. Okay, the chorion, We have here the decidua capsularis. So, ito yung sa labas. Okay? Kasi decidua capsularis. So, okay, you have the trophoblast with T. Yan, trophoblasts. And the vascular collagenous inner layer. Okay, what is the IN here? Ano tong IN? Intermediate zone. This is the remnant of the extra embryonic cilo. Okay, so another important structure that connects the fetus, connection of the fetus to the placenta is the umbilical cord. Okay, this is the umbilical cord. Cut section. So, ilang beses nyo na itong nakita? Madaming beses na, di ba? Okay. And the umbilical cord has one vein and two arteries. And the connective tissue surrounding it is the mucoid connective tissue or mucous connective tissue. The outermost layer of the umbilical cord is covered by the amnion. Okay. Okay, you also have, though we don't have slides for the external genitalia in the lab, okay? We just have to theoretically describe histologically the external genitalia. Okay, so it is composed of the mons, vestibule, labia, minora, and majora, and the clitoris. Okay, the mons pubis, so it's mostly subcutaneous adipose tissue. Okay. Okay, the vestibule is a space. Space talaga yan. That's the vaginal vestibule. Space between the labia minora, and at its wall, you can find the lesser vestibular gland near the clitoris around the external urethral orifice, and the greater vestibular gland or Bartholin's glands along its lateral wall of the vestibule, lateral wall of the vestibule. Yung lesser vestibular gland is also called your Skin's gland. Okay. Now, the labia minora is a fold of skin, okay, but it lacks hair follicles, and it has numerous sebaceous glands. The labia majora, that is the labia majora, similar to the scrotum, okay, with thin layer of smooth muscle and large amount of adipose tissue. It has sweat glands and sebaceous glands. Okay. And the clitoris is an erectile tissue with paired corpora cavernosa. Okay, the mucosa or mucosae of all of these areas have abundant supply of sensory nerves and tactile receptors. So why is it so? Kailangan yun, okay? For reproduction, for sexual arousal, okay? So to make it pleasurable to reproduce, okay? Because that's the way of, well, yun yung life eh, okay? Life reproduce, okay? Minsan kahit you put an hindrance or harangan mo, it will happen. Life happens because that's how it is. That's the natural law. Okay? Life happens. So, kita nyo nga kahit sa mga cracks along the cement or side of the buildings, may tumutubong halaman, okay? May plant because that's how it should be. Ganun talaga siya. That's the natural. Okay, you just have here an example, a picture of the labia major. Okay, and the nerve endings in the external genitalia are the following. You have the Meissner's corpuscles, the Pacinian corpuscles, and free nerve endings. Alright, so malapit na tayo. Nasa na tayo? Breast. Okay, breast is a part of the female reproductive, although it does not, hindi siya generally concerned in reproduction, but the breast undergoes cyclical changes also during the menstrual cycle and ovarian cycle. It is affected by hormones. Okay, and you have here a diagram of the breast. It is composed of 15 to 20 lobules. I think lobules. Okay, and it is drained by your by ducts. Okay, you have your lactiferous ducts here, and your lactiferous sinus here. Okay, the lactiferous duct is lined by stratified cuboidal, and the lactiferous sinus is lined by simple cuboidal. Okay. Now the skin, this is the nipple, and this is where the opening is, where you have the mammary papilla. Okay, the lactiferous ducts individually open into your mammary papilla here. Okay, the skin surrounding the nipple is hyperpigmented. Okay, hyperpigmented siya, and in the areolar area, you call that the areola, you will find the glands of Montgomery. Okay, the glands of Montgomery are produce secretions that to protect the nipple. Okay, so it has an immune function. Okay, now this is the terminal duct lobular unit. Okay, so it represents one lobule, the terminal duct lobular unit, composed of the acini or terminal ductules, okay, which drain into your intralobular duct, collecting duct, and your intralobular collecting duct will drain into your lactiferous duct. Okay. The intralobular duct and the terminal ductules are surrounded by your intralobular stroma. Okay, so the mammary gland undergoes changes also during the menstrual cycle. Okay, for menstrual and ovarian cycle. Now, during the follicular phase, okay, so yung mammary gland, meron din siyang follicular phase and luteal phase, corresponding to the follicular phase of the and luteal phase of the ovarian cycle. Okay, during the follicular phase, you have we'll just describe it here. We have less dense intralobular stroma, little or small lumen, and lined by ductals, cuboidal ductal cells. In the luteal phase, you have accumulation of fluid. Actually, no, not accumulation. You just have fluid in the stroma, small amount of secretion in the lumen, and the lining ductal cells are now columnar. Okay, so we have here in the follicular phase, okay, and this one is in the luteal phase. So you have secretions in the lumen. But during pregnancy, meron ding change. Okay? Not just a simple follicular and luteal phase. You have lactating. You have now a lactating mammary gland. Okay, and what happens? How does it develop? So it develops from the first trimester. You have elongation and branching of the ductules, and differentiation and proliferation of the ductals and myoepithelial cells. Okay, during the second trimester, you have now growth of the alveoli. Your alveoli are the secretory portion or the terminal ductules that has been labeled earlier. Okay, flattened to low columnar ductal cells. And you have infiltration of plasma cells, lymphocytes, and eosinophils of the intralobular stroma. Okay, so why do you have plasma cells and lymphocytes and eosinophils? Here, meron ka bang inflammation? Abnormal ba yan? This is not abnormal because what is the function of plasma cells? Anong function ng plasma cells? Anong function niya?
Secrete antibodies po, Doc.
Okay, it secretes antibodies. Kaya, nandyan siya. Okay? To provide antibodies to yung colostrum, yung milk. Okay? Yung the product of the mammary gland. Okay? Provides the antibodies. Also, lymphocytes. Okay? Immune function. Eosinophils also, meron siyang mga substances that can contribute to the protection. Okay? Protection of the infant pag uminom na siya, no? Pag binigyan na siya ng breast milk. Okay. Okay. And during the third trimester, you have now maturation of the alveoli, cuboidal glandular cells. You have now secretory vesicles and lipid droplets, proliferation of you have less or decline less amount of the interlobular stromal cells and accumulation of secretory products. Okay, so in comparison, this is the non-lactating breast. This is the lactating breast. Okay, here you have more of the stroma, interlobular stroma. You have less here, less interlobular stroma. You have small TDLU. Okay, maliit lang sila, empty yung lumen. Here you have dilated alveoli or dilated terminal ductules filled with secretions or yung milk. Okay. So dito you can still appreciate the lobules. Okay. Yan yung lobules. But here, mahirap nang appreciate yung lobules because of back-to-back arrangement of the secretory portions or the terminal ductules. Because they are engorged with secretions. Okay, and this is the last slide. So if you have atrophy of the uterine structures, you also have involution of the mammary gland after menopause or during or after menopause. Okay, so what will happen to the mammary gland? Secretory cells degenerate and disappear. So magiging living only ducts. So wala na siyang secretory functions. Okay? Puro ducts na lang. Okay? That will not produce or secrete any product. Okay? And the degenerative changes of the connective tissue. Okay, like you will have a decrease in the fibroblasts and collagen. and loss of elastic fiber. So that's why breast becomes sagging. It will sag after sa mga elderly because of the loss of elastic fibers. Alright, so wala akong picture nito, but this is the last slide. And okay, the resources for this lecture are textbook and atlas of Junquera and textbook and atlas of Histology textbooks and atlas by Paulina. Okay, are there clarifications, may concerns or questions? Walang questions? Okay. Okay. Question. There's a question regarding HPV infected cells in the cervix if the nucleus is really larger, if pathological. Okay, so it will depend on the case kung if it's cancerous, so it will become larger, but sometimes it becomes smaller and pycnotic, like in some viral infections, it becomes smaller and pycnotic. Okay. So it depends on the case, on the infecting agent or the etiology, whether the nucleus will become larger or smaller. But most of the time, it becomes large. Okay, no questions? Because I will give the floor to, or can may break pa sila before proceeding to the next lecture.
Maybe give them 5 minutes. 5.
Okay. You may have 5 minutes of
Bathroom break.
bathroom break and maybe a little coffee before Dr. Esguerra. Be ready for. Okay, 5 minutes.
Yeah, we will resume at 2:35.